I'm Dr. Lynn McGrath. I'm the chair of the Department of Surgery at Deborah Heart and Lung Center, where we take care of patients who have cardiac, pulmonary, and vascular disease. What makes this hospital unique is that it started off as a tuberculosis sanatorium in the 1920s for dealing with patients who had tuberculosis, particularly in the Garment District in New York City. As tuberculosis started to wane in the 1950s and was defeated by the introduction of various antibiotics, cardiac surgery started to become developed in Minnesota and then also in Philadelphia. One of the advantages that we had is that a Dr. Charles Bailey came out to Deborah and started doing open heart surgeries in the 1950s. We were the first institution in the state to do open heart surgery. Today, Deborah is a very cutting-edge institution. We're well known throughout the state, the region, and nationally for the cutting-edge care that we provide to our patients with cardiac, pulmonary, and vascular diseases. We do a large number of cardiac surgical procedures, catheterizations, stenting procedures, pulmonary operations, and the whole gamut of various vascular and minimally invasive vascular procedures for patients in our area. Many places want to say that they are a heart center within a hospital. The fact is that we are a heart center, and we have been for over 60 years. The other thing that is unique about Deborah is that all of our physicians are full-time here at this hospital. In many other organizations, the hospital's physicians and surgeons travel to various other hospitals, but here at Deborah, we're all committed to just working here and taking care of the patients at Deborah. It's easy for me to say that Deborah is a great place because I've been working here for many years and I know that patients get great care here. What's also of interest is that we get peer review recognition. For example, U.S. News and World Report, which is well known for doing healthcare organization evaluations, has recognized Deborah over the past 2 years as being a superb place for patients who have cardiac and pulmonary diseases. Over the past few years, many of our doctors have been recognized for peer review, that is to say, other physicians have recognized the quality of care provided by these physicians. And these have been published in various magazines in our area: Philadelphia Magazine, South Jersey Magazine, SJ Magazine, Inside Jersey Magazine. All of these organizations on an annual basis do surveys to find out where's a good place to go to get your cardiac, pulmonary, or vascular care. And Deborah is well recognized. Our patients have ranked us the #1 hospital in New Jersey for quality care and for patient satisfaction. And that's an independent survey. One of the reasons, of course, that patients and referring physicians view Deborah as a place to get quality care is that we have superb doctors. They're committed to this organization. And that not only pertains to the physicians, but also the other healthcare providers at Deborah. There's been a great revolution in cardiac care, and Deborah has been on the leading edge of these procedures. Operations such as doing off-pump, minimally invasive procedures, using the stereotaxis lab, and for patients who need special kinds of pacemakers and who have difficult arrhythmias. Deborah is a referral center for those types of patients. We've also recently initiated a radial artery program where patients have their catheterizations and stents placed through a catheter in the arm rather than classically put through the groin artery. Having the catheter placed through the radial artery makes for a much quicker and easier convalescence after cardiac catheterizations and stenting procedures. We're currently developing a hybrid OR where our cardiac surgeons, our interventional cardiologists, and our endovascular surgeons are able to work collaboratively to provide the best and minimally invasive care for our patients in the future. The fact that we are collaborating on many research studies provides us the opportunity to work together to provide to our patients the latest in innovative procedures. Some of the other ancillary services that we provide are a sleep lab, which is very busy, one of the best sleep labs in New Jersey and in our region. Women with cardiac disease often present with different symptom complexes than men. This is why we've developed the Women Cardiac Center. In collaboration with some of our referring physicians, Deborah is going to be developing a wound care center for patients who have difficult wound healing issues. We're partnering with the Joslin Diabetes Center from Massachusetts. Patients can come here for treatment for their complex diabetic issues. Consider Deborah Heart and Lung Center. We have a long history and we have great experience with superb outcomes, and we're very dedicated to providing the best in outcomes and patient satisfaction.